Pets are an essential part of our families. When a trauma happens, it's important to know your options for care.
My friend found a litter of kittens that were just born under her shed, and so I decided with my roommate at the time that we would take two of them in, Ted and Franklin, their brothers. When I got them, they were 6 weeks old, so they were really tiny and they could fit in the palm of my hand. They were really cute. Ted hardly ever meows or says anything. He just likes to lay around and cuddle. But Franklin is jumping off the wall. He's just a really spunky, fun cat. I came home one day and there was blood all over the kitchen floor, the dining room floor, and I was really scared of what could possibly be happening to one of the cats. And I noticed that Franklin was having a lot of problems with urinating. He would go in the litter box and he would try to produce urine and he was not successful. He was meowing and yelling and screaming constantly. It was the holiday season, so I knew I couldn't get into my regular vet, so I decided to call Valley Central and see if they could help me. I explained the situation and they told me to come in right away. In such a scary and frightening situation, I knew that that was the right place to be.
Franklin had trouble urinating, and like many male cats, they suffer from an obstructed urinary bladder. So the most common cause of that is crystal buildup, and it's important that as soon as possible we sedate and relieve their discomfort and allow them to urinate.
They kept him for a few days to make sure that he would be okay. Their emergency facilities are open 24 hours a day, so I knew that I could leave him there overnight and there would always be someone on staff to watch him, monitor him.
So after treatment in an emergency situation, your pet receives fluids and pain medicine, gets a urinary catheter, and we also look to make sure there aren't urinary stones or infection.
And then afterwards, they suggested that I put him on a special prescription diet for urinary tract health.
Prescription diets are very helpful. It's not a gimmick. They truly are made by veterinarians, so it really prevents long-term complications with the disease.
It's been almost a year now and Franklin is back to his old self. He likes to play, he's eating normally, he's running around with his brother, they're very active together. A pet is really an extension of your family. If you think that there's something wrong with them, you should definitely take them in to get checked. It's just a relief to know that there's a place like Valley Central that can take pets when they aren't able to get to their normal vet.
Franklin has done wonderful since he's been here. He's been on the prescription diet. It's almost a year now. He hasn't had any complications, and thankfully we haven't had to see him back for any more emergencies.
Joining me in the studio is Dr. Carlos Hodges of Valley Central Veterinary Referral and Emergency Center. Dr. Hodges, thanks for being here.
It's a pleasure. Thanks for having me.
It's really got to be a scary thing when your pet has an emergency. It happened to us once, and you don't know where to go and where to turn. What do patients do?
Those situations are always going to happen in the early morning hours, 2, 3, 4 a.m., and the client doesn't know where to turn. So the first thing that they need to do is call their regular veterinarian. Some practices will see their own emergencies throughout the evening. If not, on the answer machine, they will have a referral to one of the emergency centers in their area. And you'll simply give them a call and they will direct you on what you need to do.
So that's where Valley Central comes into play. So
Yes.
someone gets a referral, they come to your emergency room. You are open 24 hours a day, 7 days a week.
Yes, we are.
What happens next?
Well, when they show up, then a nurse will come out and do what they call a triage. Same thing happens in the human ER as well. So they'll take the vitals of that patient and decide how emergent that situation is. Sometimes that patient will be rushed right to the back to start with, intravenous therapies, other medications, maybe put that patient in an oxygen case. And the least, emergent patient will have to, what everybody else does, wait in the waiting room until your turn comes about to be seen by the emergency doctor.
So you assess what the needs are and then treat accordingly. It must be a scary time for patients and their owners when they come in. What do you and the team at Valley Central do to sort of alleviate the stress for the family?
Right. The receptionists and the nurses will take their time to somewhat walk the patients through the methodology or what they will be looking at. So we put them in an exam room, talk to them about what's going to happen next. The doctor comes in, explains everything in detail. So we try to make them feel as comfortable as they need to. If the wait is going to be long, we try to keep the client updated as far as what's going on, how soon are you going to be seen, and those type of things.
Well, sometimes an emergency does result in needing surgery, and I understand at Valley Central you're doing some very innovative procedures that are not really being seen in this area. Tell me about those.
Right. I mean, it depends on what the problem may be, but we are set up now for laparoscopic type surgeries, arthroscopic surgery, which doesn't so much happen on an emergency type basis, but minimally invasive procedures are huge now. I mean, you would want them for yourself if you had some sort of issue that needed to be attended to.
Speaking of medical advancements for pets, you offer all kinds of services. Can you tell us a little about that? Cardiology,
Sure.
oncology?
Yes, we do. I mean, I need to emphasize that we are an extension of the regular veterinarian. So when that client needs some specialty needs, heart problems, so we have cardiology, ophthalmology, oncology, internal medicine, surgery, and acupuncture. And we also have a behaviorist as well.
It really is amazing what you guys are doing. How does it make you feel as a vet, treating patients for so many years, dealing with their owners? How does it make you feel when a pet goes home healthy with their family?
That has to be the greatest feeling of all. We've been here for almost 18 years now. And just the smile on an owner's face when they bring that dog in hit by a car, it has a broken leg, it can't walk, it's in pain. They come to pick it up 2 days later, the animal is very comfortable, the owner's smiling, they're happy, we saved their pet. I mean, that's the best feeling in the world. That makes my day. That makes me sleep well at night.
Dr. Hodges, thank you so much for being here.
It's a pleasure. Thanks for having me. This is fun.
For more information on emergency care for your pet, go to our website at thepeaktv.com. And coming up next, take a look at a doctor who's running 5Ks for more than fitness. This is The Peak. The Peak TV is a production of ASR Media.